Hello friends, in continuation of Recall NEET PG 2023 Biochemistry MCQ, we are going to discuss further 10 more MCQs. So first MCQ, that is, which of the following is seen in low insulin glucagon ratio? So here option is, or question is about low insulin glucagon ratio. So whenever this low insulin glucagon ratio, you have to think only one thing. Low insulin means insulin level is low, and oppositely low insulin glucagon means comparatively glucagon level is more in the blood. Now further related to the hormone, you are knowing that insulin glucagon both are opposite in action. Insulin basically targeted to decrease blood glucose level. How it is decreasing blood glucose level? Only target to utilize blood glucose, and this glucose utilization is possible with the help of either glucose will diverted to the glycolysis pathway or glucose is diverted to the glycogen synthesis pathway. And exactly opposite to the glucagon, what will happen? That will lead to the formation of new glucose molecule, that is gluconeogenesis, and oppositely glycogen breakdown. So glycogen breakdown will also provide the glucose. Now in general, glucose level is elevated when we are taking the diet. So after taking of diet, generally glucose level is increased. So after taking of diet, generally insulin will be released. But after some time of the taking of diet, when blood glucose level is going to down, during that time glucagon will release. So here, that basic thing about insulin glucagon that you have to keep in your mind. Now question is about low insulin glucagon ratio. Then we will look which are the options. So which of the following is seen in low insulin glucagon ratio? So here we have to find out what will be seen when particular thing or particular function will occur under the presence of the glucagon. So what function will be done by glucagon? That is an indirect question which is asked in this MCQ. So first, activation of lipoprotein lipase. Now this enzyme lipoprotein lipase is basically targeted to utilize VLDL as well as chylomicron. Now lipoprotein lipase is targeted to utilize whatever the lipid is present in the blood, and that is taken up by the peripheral tissue. So basic target of this lipoprotein lipase to metabolize chylomicron VLDL. Chylomicron is basically generated when we are taking the diet. So this will be possible when it is presence of the insulin, means high insulin level. Second, activation of glycogen synthesis. So simple, insulin favors the glycogen formation. So glycogen synthesis is activated under the presence of high insulin level. So activation of lipoprotein lipase, that is also under high insulin level. Activation of glycogen synthesis, that is also under high insulin level. Further, activation of phosphofructokinase 1, that is simply PFK1, which is also a part of the glycolysis pathway. This glycolysis pathway is also activated under the presence of the insulin, so means high insulin level. Now fourth option, that is activation of hormone sensitive lipase. Now this hormone sensitive lipase, that is under the effect of glucagon, and under the effect of glucagon, this hormone sensitive lipase metabolize triglyceride which is present in adipose tissue, and that adipose tissue will liberate the free fatty acid, and that will go to the liver. So hormone sensitive lipase, that is basically under the effect of the glucagon. So low insulin glucagon means there is a indirectly high glucagon level, and that is occur, and that will lead to the following action, means activation of hormone sensitive lipase. So right answer here, that is activation of hormone sensitive lipase. So you have to choose option according to the question. So first you have to understand what is the question, low insulin glucagon ratio, and from that low insulin glucagon ratio you have to identify what is the meaning of this question. And according to insulin glucagon, simply you are knowing everything about insulin glucagon, just you have to apply your logic, and that will helpful to choose the right option. Further, next MCQ, that is an infant is brought by his parents with complaint that his urine turns black on standing. So typical black color of urine. Which of the following metabolic disorder is likely? So here definitely hint is given, black color will occur in the urine, and simple in biochemistry one thing, black color urine, typically one thing you have to remember, that is for the alkaptonuria. Which enzyme is deficient? Homogentic acid oxidase. And it is related with the which particular amino acid metabolism? Phenylalanine to tyrosine, and tyrosine to that breakdown of tyrosine, during that time homogentic acid is generating, and this homogentic acid further metabolism is possible with the help of homogentic acid oxidase, and that enzyme deficiency lead to the alkaptonuria. So here option is phenylketonuria. No, it is phenylketonuria, that is deficiency of phenylalanine hydroxylase. Alkaptonuria, that is definitely the right answer, that is black color of the urine. Other, that is homocystinuria, that is also another thing, thing that is related to the cysteine and methionine metabolism. Maple syrup urine disease, that is MSUD, that is also due to the related to the branch chain amino acid metabolism. So definitely right answer is that is alkaptonuria. So whenever the particular hint is given and that hint you have to choose, and according to that you have to choose the right answer. Now next MCQ. A child present with thinning of hair, scaling of the scalp and alopecia. On taking further history, it is found that she consumes raw eggs in her diet regularly. The given manifestations are due to the deficiency of which of the following vitamins. Now definitely whenever this word raw egg, so you have to also remember particular sources of the foodstuff or particular sources or foodstuff for the particular molecular requirement in our body. Raw egg, that is definitely related with the one particular thing, that is avidin and biotin. Now avidin which is present in raw egg, which is tightly bind with the biotin, and biotin will not be available in this person. So definitely all things are related with the hair, scaling of the scalp and alopecia, all are related with the hair. Nowadays also you can see the advertisement also that biotin is added in the shampoo and everything. So definitely it is related with the biotin. Now we will look the particular option. So given manifestation are due to the deficiency of which of the following vitamins. Now niacin related skin hair disorder are generally not skin. Niacin deficiency lead to the, that is dermatitis, that is totally different thing, that is not a related with the hair. Okay, thinning of hair and alopecia is not mentioned in the niacin. Pyridoxine, that is also related with the particularly anemia and convulsion as well as amino acid metabolism. Now biotin, that is definitely related with the carboxylation reaction, but this biotin that is also required for the, that is main source, that is biotin, that is easily available in the different foodstuff. But raw egg, that is containing particular one material, that is one molecule, that is avidin, which is tightly bind with the biotin, and this biotin is not available for the absorption. So whenever the person is taking raw egg, that may have deficiency of biotin. So most likely deficiency is biotin. Another option, that is thiamine. Thiamine, that is vitamin B1, that is leading to the beriberi, as well as you have to remember wet beriberi, dry beriberi and Wernicke-Korsakoff syndrome, which is related with chronic alcoholism. So here definitely the right answer, that is biotin. Now one more MCQ. A child present with difficulty in vision, mental retardation, bone pain and inability to walk. On fundoscopic examination, a cherry red spot is seen. There is no organomegaly. What is the most likely diagnosis? Now, some particular characteristic or some particular disease that you have to remember in biochemistry, like glycogen storage disease, sphingolipidosis, mucopolysaccharidosis. Now, in that at all condition, some clinical features, classical clinical features are there. Now here it is written that mental retardation is present, vision is affected, bone pain, inability to walk, and most important thing, that is cherry red spot. Now this cherry red spot, that is typically seen in particular storage disorder, and which are the disorder that we will look, as well as you have to remember no organomegaly. Now most of these storage disorder like lipid storage disorder, glycogen storage disorder, they are mostly related with some organomegaly. But that is the hint, no organomegaly, that is a hint for our particular question. Now from this option we have to select Tay-Sachs disease, that is hexoaminidase A or B. That particular Tay-Sachs disease, hexoaminidase A enzyme deficiency is there. Niemann-Pick disease, which is related with the sphingomyelinase enzyme deficiency. Hurler syndrome, that is mostly L-iduronidase enzyme deficiency. Gaucher's disease, that is related with the glucocerebrosidase enzyme deficiency. Now I have given some hint over here. So basically it is written that difficulty in vision, cherry red spot, mental retardation and no organomegaly. So typical thing, that is no organomegaly. So now whenever you are attending this MCQ, you have to think about the particular cherry red spot, which is typically seen in Tay-Sachs disease as well as in Niemann-Pick disease. But in Hurler's disease and Gaucher's disease, red spot or cherry red spot is not seen. So thing is that whenever you are talking about particular MCQ, you have to select the particular option, and for that option you have to choose selectively. So basically cherry red spot, that is seen in a Tay-Sachs disease as well as in Niemann-Pick disease. But for the mental retardation, that is also seen in three conditions: Tay-Sachs disease, Niemann-Pick disease and Hurler disease. Gaucher's disease more related with the CNS problem but not typically mental retardation. Now here you have to remember that this Tay-Sachs disease and Niemann-Pick disease. Out of that, Niemann-Pick disease is also related with the hepatosplenomegaly. So gradually you have to remove the different options. So Gaucher's disease, that is more related with the anemia, hepatosplenomegaly, bone erosion. So bone pain is there, bone erosion is there. So they are related, but Gaucher's disease more related with the hepatosplenomegaly. So here no organomegaly, so Gaucher's disease is ruled out. Hurler syndrome, which is related with the corneal opacity, hepatosplenomegaly as well as mental retardation. So Hurler disease, that is one of the mucopolysaccharidosis, but here also particularly Hurler syndrome, that is ruled out because it is related with the hepatosplenomegaly. Niemann-Pick disease, that is basically with the help of sphingomyelinase enzyme deficiency, here also mental retardation. Further red spot is seen, hepatosplenomegaly is seen in Niemann-Pick disease, so this option is also ruled out. So only right answer, that is Tay-Sachs disease, because here no organomegaly is particularly written. So whenever you are attending MCQ, you have to read total full MCQ, and from the full MCQ you have to identify the keywords, and from the keyword you have to choose the right option. So no organomegaly, that is leading to the particular identification of condition, that is Tay-Sachs disease. So right answer, that is Tay-Sachs disease. Now another MCQ, that is a child present with a bone pain and hepatosplenomegaly. A refined biopsy and aspirate show the following finding. Which of the following is the most likely enzyme deficiency in this condition? So basically here that one histological slide picture is also seen. Now in this typical, that particular one picture is shown, and this rounded, which is that particular area that you have to choose and that you have to identify. In this picture, that particularly crumpled tissue paper cell, that is the typical hint for this question. So crumpled tissue paper cells, that is seen in this histological picture, and that is giving the idea about the question. Now a child present with bone pain, hepatosplenomegaly, refined biopsy and aspirate show the following finding, that is the picture is shown. Which of the following is most likely enzyme deficient in this condition? So only thing, that is hepatosplenomegaly, that is given as a hint in this question. So we have also seen that Gaucher's disease, which is related with the hepatosplenomegaly, and this Gaucher's disease typically you have to remember crumpled tissue paper cell. Now which enzyme deficiency in Gaucher's disease? Glucocerebrosidase. So you have to remember which enzyme deficiency in which particular disease. So name of disorder and which enzyme is deficient, and their characteristic finding that you have to remember. So hexosaminidase A and as well as hexosaminidase A and B, that is totally two different things, but that is related with the Tay-Sachs disease that we have seen in the last MCQ. Glucocerebrosidase, that is typically related with the Gaucher's disease. Here the MCQ is related with the crumpled tissue paper cells, that is typical answer, that is glucocerebrosidase. Sphingomyelinase, that is particularly related with the Niemann-Pick disease, and here also you have to remember mental retardation, hepatosplenomegaly and cherry red spot, that is seen in a sphingomyelinase, but that anything is not written, only hepatosplenomegaly as well as this picture is given. Alpha 1,4 glucosidase, that is more related with the Pompe's disease of the glycogen storage disease. Now Pompe's disease is more related with the cardiac condition. So cardiac related condition, that is explained in the question, then you have to choose the alpha 1,4 glucosidase. So from this MCQ you have to directly jump from the picture, definitely the answer is Gaucher's disease or the glucocerebrosidase. So right answer, that is glucocerebrosidase. Now one more MCQ, there is a history of village people consuming crop as a staple diet. Many of the villagers are now presenting with a paresis and are using a stick to stand. Which of the following vitamin would help? Now here option is given related to the diet. People are taking staple diet as a particularly local crops. So crop, that is as a staple diet. Now what is the problem? They have a presenting with the paresis. Paresis means muscle weakness are seen, and they are also using the stick. So these are the hint from the question. Now option are vitamin A. Vitamin A typically related with the vision, and as well as it is related with the skin and mucous membrane. So here vitamin A is not likely the option. Vitamin D. Now vitamin D is more related with the two typical condition, rickets and osteomalacia, and that osteomalacia, that is related with the particularly older age. So vitamin D, that is more related with the bone. Now further option we will look, then finalize. Now vitamin C. Now this vitamin C is related with the particularly this collagen formation as well as collagen formation and this extracellular matrix that is the basically formed with the help of vitamin C. So also that is one of the option. Now vitamin K, now this vitamin K that is also particularly related with the clotting factor 2, 7, 9, 10. So here out of these four options A, D, C and K, it is not likely related with the vitamin A which is related to the vision, skin and mucous membrane, vitamin K for the clotting factor, D that is more related with the bone condition, but vitamin C that is related with the collagen fiber. So paresis that is muscle weakness and that is more likely to this because vitamin D that is related to the village people. Mostly village people is not likely to have a vitamin D deficiency because they have commonly proper exposure to the sun. Proper exposure to the sun that is not likely to the vitamin D deficiency. So from this option I can choose the particular right option, that is vitamin C is most likely in this condition. So you have to choose the right option according to the situation, according to the case scenario. So here most likely the proper option that is vitamin C. Now another MCQ. Which of the following micronutrient deficiency can cause poor wound healing? So iron deficiency, poor wound healing, that is the typical hint in this. And another thing that is micronutrient. Now this word micronutrient is also important because there is a micromineral and macromineral. So some minerals are required more in quantity, they are the macrominerals. Micronutrients means they are required in a small quantity. So that also you have to remember. Iron that is also one of the micronutrient, but it is not more related with the wound healing. It is typically related with the anemia and anemia related conditions. Zinc deficiency that is also more related with the particular zinc, that you have to remember two words, perioral and perianal region. So zinc deficiency that typical whenever the clinical case presentation, that two word mostly written, perioral or perianal region. Calcium deficiency, now calcium is directly ruled out. Why? Because I have said that micronutrient calcium requirement is about 500 milligram per day for normal adult person. So calcium is definitely not an option because it is not a micronutrient. Copper deficiency. Now copper that is required in a small quantity. Now here copper deficiency that can lead to the affection of collagen formation. So collagen that is basically one of the extracellular matrix which is required for the wound healing. So whenever the injury, cut injury, so healing process, during the healing process extracellular matrix is required, and for this extracellular matrix basically collagen fiber is required, and for the collagen fiber formation copper deficiency that can affect the wound healing. So copper is required for the lysyl oxidase enzyme activity. So lysyl oxidase which is requiring copper, so this enzyme will be affected, collagen formation is affected, and that can lead to the poor wound healing. So here definitely option that is copper deficiency. Now another option or another MCQ, that is a person presented with a neurological manifestation mimicking upper motor neuron palsy and sensory neuropathy. The patient was pale and investigations revealed anemia. The probable deficiency in of. Now here neurological manifestation is given, upper motor neuron sensory neuropathy is given, patient was pale and investigation revealed anemia. So this anemia, definitely anemia word is there, we can think about the iron, we can think about the anemia related molecules, definitely vitamins. Which vitamin? Basically vitamin B6, B9, B12, okay, these three, as well as vitamin C. These four are mostly related with the anemia, as well as fifth mineral that is iron. Now which are the option? Probable deficiency of vitamin B12, so that is also one of the option for the this anemia. B9 that is also related with the anemia. B3, now this B3 is not related with the anemia, but this B3 is this B3 that is related with the B6 but not related with the anemia. B1 that is definitely not related with the anemia. So basically two option, vitamin B3 and B1 is ruled out. Two option is remain B9 and B12. Now B9 that is folic acid, B12 that is cobalamin. Now B9 which is folic acid which is not related with the particularly neurological manifestation. Neurological manifestation that is definitely with the vitamin B12, and this B12 deficiency lead to the subacute combined degeneration. So here the right answer that is vitamin B12 deficiency. So from the MCQ you have to catch the hint, you have to rule out the other option, and then you have to choose the final answer. Now respiratory distress syndrome is caused by the deficiency of, so RDS that is typically condition, clinical condition, and why it is occurring. So that which molecular deficiency can lead to this situation. So options are sphingomyelin, that is one of the phospholipid. So sphingomyelin, that one thing. Cephalin, that is also one of the phospholipid. So another, that is lecithin, that is phosphatidylcholine, that is also one of the phospholipid. And cardiolipin, that is also one of the phospholipid. So all these, cardiolipin, lecithin, cephalin, sphingomyelin. Now out of that, for the respiratory distress syndrome, you have to remember one thing, that is LS ratio, lecithin sphingomyelin ratio. So after the 30 week of the gestation, what happened? Basically, lecithin is gradually released, and that is gradually increase in number. So when lecithin is sufficient, when LS ratio is more than 2, that is called as a lung maturity. But when this lung maturity is not seen because of the deficiency of lecithin, that can lead to the respiratory distress syndrome. So here LS ratio means, L means lecithin, S means sphingomyelin. Both options are given, but sphingomyelin, that is gradually decreasing, and lecithin level is gradually increasing. So ratio is more than 2 or 2. That is helpful to identify lung maturity. So right answer here, that is lecithin. So when lecithin is deficient, that can lead to the respiratory distress syndrome. Sphingomyelin deficiency is not related, but that is mostly lecithin is seen in a comparison of the sphingomyelin. So basically requirement of the lecithin, that is helping for the maturation of the lung. So LS ratio, which is lecithin, which is gradually releasing after the 30 week of the gestation. So here the right answer, that is lecithin. Now another MCQ, that is a 5-year-old child is presented with bow legs. The probable diagnosis is, only one hint is given, that is bow leg. Sometime instead of this particular word, it may be shown as a picture. From the picture you have to identify what condition is that. So bow leg, knock knee, rickety rosary, Harrison sulcus, these are the typical words which is given for the rickets. So whenever the words like typical words are given, that you have to catch, and from that you have to identify. Definitely it is related with the rickets. Scurvy is not related with the bow legs. Rickets, that is mostly right answer. Phrenoderma, that is also not related to this particular bow legs. Phrenoderma, that is seen in a vitamin A deficiency. So phrenoderma, that is related with the skin, and mucous membrane derma, that is skin, that is more related with the vitamin A. Pellagra, that is definitely related with the vitamin B3, niacin. So here the right answer, that is the rickets. So here basically we have recall all NEET PG MCQ of 2023. From the MCQ you have to get the hint, and from the hint you have to choose the right option by removing all other options. So if you rule out all other options, you can definitely get the right answer. So best of luck for the NEET PG 2024. Further, all MCQ of the previous year we are going to cover in this video series.